Hi, this is Paul Tunnah from Healthware, and welcome to another Health Innovators video discussion. Really pleased today to have Rich Andrews here from Healios. Rich, thank you so much for joining me.
Paul, it's a pleasure. Yeah, really looking forward to our catch up.
Now, you and I have known each other for quite a while. We kind of started our careers way back at a data monitor and then went off in different directions. But I guess both come back in one form or another to digital health as a kind of passion. So before we get on to Healios, tell me a bit about your journey and how it's taken you from that point to where you are now.
Sure. Well, yes, we were a few years ago together at Data Monitor in that healthcare space, and for me, that was a really great grounding to get that kind of first start in your career in that more global perspective of that healthcare environment. And that next step after Data Monitor was actually moving into the pharmaceutical industry world and starting out with Aventis and then Sanofi Aventis, working through roles within market research and into product management in areas like diabetes, through to companies with GSK and Hoffmann La Roche, where I spent several years living in the US and living in Switzerland in an international career, working much more than within kind of global product strategy. So that gave me a fascinating career across the life cycle of bringing innovative products to market.
So you traveled the world, you saw the ins and outs of big pharma, but then you started more recently Healios. So before we come on to your kind of inspiration for that, which I'd like to hear a bit more about, just tell me about Healios, what it is, what you do.
So Healios is, in essence, a digital clinic that we've created for managing the complex needs of children and young people who have mental health challenges such as anxiety or depression or neurodiverse conditions like autism or ADHD. So we bring an extensive clinical care service to children and young people with those conditions, involving their family to help them improve overall their mental health and emotional well-being.
This is not just something online, is it? I mean, you hinted at that there. This is kind of linking online support with actual, human interaction, I guess.
That's right. Yeah. So as part of our digital kind of clinic, we bring a multidisciplinary care team through technology to wrap around the kind of clinical care needs of that young person and their family. And so that multidisciplinary team is made up of psychologists, therapists, also psychiatrists, to really bring kind of the right human touch at the right point, with that supported or augmented with self-management tools that can help them on a day-to-day basis.
Yeah. And obviously the whole topic of, mental health and these kind of conditions, there's been a lot more talk about it recently. And particularly with COVID, I think that, again, that sort of raised the issue to the fore. But you've been operating in this space for quite a while now. So what was your inspiration for Healios? Why this space? Why this kind of approach?
So yeah, Healios is 8 years old now, and the reasons for me taking a leap out of a really kind of fascinating career in the pharmaceutical industry was driven by actually family members and friends who had mental health challenges and also areas like dementia, which of course is not a mental health condition. And just seeing loved ones just really bounce around the system here in the UK, not getting the help they needed, was really tough to see and really stressful actually as a loved one seeing that. So decided that there's something wrong with the system here. It's broken in many different areas, and felt really compelled to do something about it. So took a leap over 8 years ago, and on what was an incredibly exciting journey to date, but a huge amount of naivety at the time. Sure. And decided something had to be done, and made that first step, starting Healios.
Yeah, that's a great move. And that classic, I guess, entrepreneurial thing of spotting a problem and thinking, well, I'm not going to wait for someone else to sort this out. I'm going to dive in and do that myself. But for you at that time, I mean, I guess working in big pharma, quite a leap of faith to some degree. Was it hard to kind of make that move?
So I think I was quite surprised actually that I had very low levels of anxiety around making that move. And again, I think that's linked to kind of the huge amount of naivety that I think you often need when taking that jump into the unknown. I think what really helped was, having that quite rigorous training in that healthcare industry about how to bring innovative products to market into the different healthcare systems. So knowing I kind of had that kind of knowledge and experience, although at the macro level, I felt kind of I had a good grounding in a way. But once you start out, you realize actually there's a lot to learn. And it's been, a learning curve, quite a steep learning curve ever since then.
Yeah, and that what you don't know, that naivety as you describe it, I think anybody that started a company, and I'll include myself in this, what you don't know is just incredible. In a way, it's probably quite good, because if you knew it at the time, you'd think, well, should I really be doing this? But you kind of start out on that journey. And for you, in those first few years, getting it all going, were there some sort of major hurdles? What were the things that most surprised you about trying to get this company started?
So I think a lot of entrepreneurs, I mean, like yourself as well, it's about sort of finding that great team to start with, and that is always a big challenge. How do you kind of pull in people, particularly around just an idea that's on the drawing board at that stage, and build confidence that we can make this work, and other people can take a leap with you, in that first phase. So I think that's, of course, I think personally found that as a tough challenge to assemble that team, and it's certain individuals who are willing to work in an environment that does have a large amount of unknown aspects to it, and an environment that doesn't have that large organizational structure around it to kind of bring that kind of psychological safety, that we all have in organizations. So that was a tough first step, and just building that team and having them work, really well together, through to how we ultimately wanted to engage with our customers, and the beliefs and the behavior change that we needed 8 years ago to drive this innovation into clinical pathways. So there's other kind of challenges as well then that we faced pretty soon after starting.
Was there anything you kind of missed when you made that move from big company to, I guess, to begin with, just you and a startup? Anything you thought, oh, actually, I'm not in a big company anymore?
Yeah, I think that first is when that paycheck doesn't come through. That's one thing you miss straight away. That monthly certainty almost. I think also the fact that when you're in a big company, you're able to tap into some great minds, and bounce ideas around in different ways. I think you do miss that aspect. You're very much kind of on your own, no one to fall back, on, and that is tough starting out. And so that's why that team dynamics, getting the right people around you, is even more important, because as you've experienced, it's a roller coaster ride trying to build something and get some market traction, and you hit quite a few roadblocks along that journey.
And the whole field of digital health, or whatever terminology people wish to use to describe it, has just exploded. I mean, COVID feels like it's accelerated it. There's more investment coming in. It's getting an increasingly busy marketplace, which is good overall. But for you, how do you differentiate yourselves within that space as there's more and more people coming into it?
So I think for us, it's that kind of ruthless pursuit of better and better outcomes for children, young people with mental health conditions or neurodevelopmental conditions, and keeping kind of a razor sharp focus on that. Because I think if we can continue to focus on that, and then linked to achieving better and better outcomes, naturally is what's tied into that is then the product experience to get the engagement to achieve those outcomes. So I think what's really important is that constant pursuit of doing things better and better to get better outcomes. And I think that will naturally help you kind of stay ahead a little bit of the competition, not much, but a little bit by that pursuit. But I think then there's other layers to that. So things such as innovation, investing in innovation to drive those better outcomes, how we want to partner in different ways to gather that data and in that continuous cycle around those new innovations. So all of that wrapped together, I think, is an important kind of component of how we are trying to stay ahead and stay differentiated in like you say, Paul, and in a very noisy market these days.
Yeah, and I guess you've got to keep an eye on what else is going on, but that sort of sticking true to your vision and knowing kind of where you're going must become quite a sort of, I guess, a North Star in what you're doing as you look at all this noise.
Yeah, that's right. Yeah, and it helps getting the organization behind something that, you know, that's very meaningful and purposeful to them as well, and quite clear. And when you're at a very young stage, sometimes you've got several North Stars up there and you're trying to figure out which one you're heading towards, because you're pivoting a little bit, you know, as you're building different products, again, different experiences with that. And I think, you know, over the years, you kind of get a little bit more clarity on where you're heading, because you've been testing, you know, lots of different, you know, elements of your product with different customers and things. So that kind of clarity on that North Star, as you said, is super important for the whole company to get around.
Yeah, and talking about pivoting, I mean, you think about the last 18 months and this weird COVID situation we've all lived through. It's certainly accelerated digital interventions in some cases. Has it had much of an impact on your business?
So I think with, I mean, as you say, we've seen just a massive adoption of digital healthcare. I think almost this jolt that the world's had through COVID has helped a lot of healthcare systems just move to kind of telemedicine and doing virtual, and we've seen that massive uptake. For us, I think with this area that we're in, which has been really in crisis for so many years now. So if we take the UK, for example, only 1 in 3 children pre-COVID were getting the mental health services that they needed. So 2/3 of children weren't getting the support they needed already pre-COVID. And so COVID has just made the situation a lot worse. The gulf between demand and capacity now is much bigger. And so what we've just seen now is just even greater focus on the area that we're working in. We already had great traction with our amazing NHS partners already, but now it's just accelerated a bit more the embedding of these digital innovations on care pathways.
Yeah, and you're right. With the impact of COVID, it feels like, you know, perhaps we're just seeing the tip of the iceberg with some of the problems caused by COVID, unless we start to make the right moves and tackle some of these issues. Yeah,
that's right. And I think the world did need that jolt in a way. So it's a silver lining to some degree with COVID. But this really is about how overall that kind of approach is, how do we design services that are fit, you know, for patients and their family? And of course, digital is one component of a broader kind of strategic approach to designing services. And what the pandemic has enabled is more people to kind of really look at the value of digital in these new kind of care pathways. And I think that's really helped.
Yeah. And you've had a major investment raise earlier this year, which we could have a whole separate conversation about the challenges of raising money, and I'm sure there's plenty of learnings there. But that means you're in aggressive growth mode. So what's your focus right now? Where are you investing? What are your plans over the next 6 to 12 months?
So it's a really exciting raise, and it's great to get further backing from investors who really believe in what we're doing and the impact we're making. And so for us, certainly over the next 6 to 12 months, is to continue to embed that with more and more NHS partners. We are commissioned by 62% of the NHS in England already. So we've already got amazing traction, which has been fantastic. And it's just about continuing to work with them over the next 6 to 12 months with supporting their needs in different ways, how we're bringing new products and services into their care pathways, and continue to drive the evidence of the work we're doing. So that's still a big focus for us. Continue to build those relationships and embed with our partners our clinical models. And then we have, of course, this international ambition as a company. We really want to tackle what is a crisis in children's mental health and neurodiverse conditions worldwide. And part of our objectives in the near term is making that first step in international expansion, which is now underway, and we're really excited about starting our process to deliver clinical services in the US, and we have that process underway now.
Yeah, and to those that don't know that, I mean, it's tremendously exciting to be looking beyond the UK and thinking about that expansion. And as you know, it's not always easy. But for those that don't know the UK and the NHS, being in, I think you said 62% of the NHS, that is an achievement because it's not like you walk up to one person and go, here's what we're doing, and they get you in everywhere. It's like lots of little clusters, isn't it?
Yeah, that's right. So, of course, with the NHS, it's a devolved system where budget is handed down from NHS England to then the local areas who commission services. And so then there's often local NHS organizations that are the prime providers for those different regions around the country. So that's where we have then our contracts is with those local NHS organizations to partner with them to deliver care. And what that means, of course, they're like mini companies. They all have their own kind of cultures, their own kind of ways of working, their own kind of clinical processes. So we've had to really learn a lot in how to kind of transform care pathways in lots of different NHS organizations and support that local culture with that change that's needed, support those local clinicians on how to talk about our services, how to present that in ways to the patient and family that makes sense. And also to support them as we're working with those patients and families that we're very much then integrated in that local kind of system. So yeah, that's been a huge learning curve for us as a company.
And looking at the US market is, really exciting to think about that. I guess as soon as COVID allows, you'll be spending a bit more time stateside. Anything you can share at this stage around plans for the US and what your approach will be?
So we are looking at how we take all the learnings that we've done in the UK and what we've built in the UK that's got some incredible traction and shown to work, and take that approach to the US, because we feel like there is a similar kind of opportunity there and clinical need across both children's mental health and neurodiverse conditions. So we want to take what we've learned in the UK, bring that over to the US with some local adaptation to our clinical processes. But largely we feel actually that it's a very similar kind of approach clinically to how you support a young person with their needs. And that's where we want to start. We're just picking one state. We want to kind of build kind of some early kind of experience there and outcome data and working with local providers and payers, just to kind of see how we get on in that first phase before then, of course, hopefully moving into more of a multi-state expansion.
Yeah, that's great. We'll keep an eye on that one with interest. And we've commented on how fast, digital transformation is moving and digital health is moving. So how do you think the mental health landscape is going to shape up in the next 5 to 10 years?
So there's so much change happening in the mental health space. I think one of the big areas that is going to change clinical care is the use of data, and this really is to overcome probably the single biggest challenge that psychiatry has had for decades, which is it's largely based on subjectivity. So that's the area where we ask patients to complete questionnaires on how they're feeling. And that may be over the last 2 weeks or over the last 2 to 3 months. And it's all based on that subjective recall to answer questions. And that creates a clinical score, whether you have, say, clinical levels of depression or not. And that's also the same with pharmacological treatment of mental health conditions like depression, is to evaluate the effectiveness of that drug. Again, is about completing clinical questionnaires. So there's no equivalent of cholesterol. There's no equivalent of blood pressure that you monitor. So data is going to be so powerful going forward in kind of bringing some more objectivity into how we are evaluating whether someone has a mental health condition in a more objective way, whether a certain treatment approach is actually working or not, with earlier indicators so we can change that treatment plan a bit sooner. So data will drive so many different advances in this field over the next 5 to 10 years that it's super exciting right now.
Yeah, it's a great point. And that objectivity, of course, has played a part in drug development as well, in clinical trials, where it can be quite hard to kind of demonstrate an impact. So better measures around that, I can see that's going to really transform this space.
Absolutely. Yeah, it has ramifications across all aspects of the care pathway.
Now, I do like to ask people, and you've obviously shared the story of why you started Healios and your passion at the start of that journey, but are there any particular individuals or individual that's kind of inspired you as you've built this company, or continues to inspire you maybe?
So there are a lot of role models out there to learn from and be inspired by. For me, it was actually my grandfather. So my grandfather, he was in the war, World War II, and he got really badly injured fighting in the war, and he came back to the UK with nothing, and he built from nothing several businesses that were really successful in the Midlands. And that for me was just so inspiring to hear that when I was growing up. And not only that, when he had sold those businesses, he was still working into his 70s and the early 80s. And I remember kind of staying with him as a child and going out with him, and he was doing lots of odd jobs with the neighborhood, and just learning from him and his just passion for the work he was doing, his commitments to still doing great work, even though it's for neighbors and all sorts of kind of handyman type jobs. But to see that, and while he is still injured, of course, and that was just for me just a great kind of moment, and it shaped my thinking. And so when I started the Healios, that was, reflecting back on being with my granddad at the time, and what I learned was very inspirational, and it continues to inspire me today. So that's probably someone I always look back on as a shaping moment for me.
That's a great story. And you probably find yourself thinking at various points, what would his advice be at this point, and what would he do?
Absolutely, yeah. And he's a guy who could tell some fascinating stories. If I can certainly follow in his footsteps, and that would be an amazing thing to achieve.
Fantastic. And as you look forward then, or as you think about your experience and what you've kind of gone through, is there one bit of advice you'd give to anybody starting out? Probably lots of advice, but any one piece in particular that kind of strikes you?
So, gosh, I think in particular with digital healthcare, it's such a rapidly evolving space, and there's so much noise out there at the moment. And I think for people who are starting out in this particular area, I think making sure that you are super clear with your proposition to customers, and even to, of course, patients, in the sense of the end user, but certainly to payers, and how your digital solution, whether it's more of a solution that's fitting in delivering care, or whether it's a solution that supports an aspect of that care pathway, that for that proposition just to be clear, very simple, very succinct, because there's a lot out there for a customer to kind of to evaluate and try to understand, how does this add value in my local system? And so I think getting that right, being crystal clear on what you're trying to deliver, where you're trying to add value, I think it's going to be even more important in this very crowded kind of place now, with lots of people knocking on doors.
Yeah, that's great advice. It kind of, they're not getting too obsessed with the product and thinking about the application. Rich, it's always great to catch up. It's been great to do this video interview though, and hear a bit more about the story and some things that I've learned, including the story about your grandfather, who I'm sure would be really proud of what you've achieved. So thank you so much for taking the time to chat with me.
Oh, it's been a pleasure today. Always great to catch up. Thanks so much.